is celiac disease? Long and short of it, just a little bullet points. An intolerance to gluten and the way that it manifests in your body can be very catastrophic. But gluten is one of those things that I wouldn't really recommend anybody really consuming because it's highly inflammatory in the body. And most of diseases and sicknesses and illnesses that manifests inside the human body are normally caused or helped along by inflammation. So you normally want to limit that as much as possible. And that's something that we talk about a fair amount on the channel here. So I'm going to dive into the specific disease that has the most adverse effect when it comes to gluten. Just about everybody loves the smell of freshly baked whole wheat bread. Not really. Okay, well, I guess I'm in the minority, so statistically insignificant. But not everyone can afford to take a bite. For anyone with celiac disease, this treat is practically poison. People with this condition are extremely sensitive to gluten, a class of proteins found in all food made with wheat, rye, or barley. Even small amounts of these proteins can damage the intestines and block the absorption of vital nutrients. Gluten doesn't harm the intestines directly. Instead, the proteins set to the immune system into attack mode. The body releases powerful antibodies to fight the intruder. Finding no germs to destroy, the cells turn against the linings of the intestine, ergo an autoimmune response. What causes celiac disease? Funny you should ask. People with celiac disease have inherited genes that make them sensitive to gluten. However, not everyone has such genes shows the sign of the disease. Scientists believe that the disease needs to be turned on before it can cause any problems. Large amounts of gluten during infancy and early childhood seem to set up the disease in motion. Some adults first notice symptoms after injury, infection, childbirth, or a severe period of stress. So what are the symptoms of celiac? In toddlers and older children, common symptoms are nausea, stomach pain, lack of appetite, anemia, mouth sores, and blistering rash. The rash most often found on the elbows, knees, and buttocks. All right, may be the only indication of the disease. Children who don't absorb enough nutrients can show signs of malnourishment. All right, may become pale and thin with a bulging stomach. The disease may delay puberty or slow down growth in teenage years. That sounds terrible. Adults who develop celiac may have mild intestinal problems, but most don't get off easy. Adult patients often feel tired, irritable, and depressed. And because celiac can block the absorption of calcium and iron, many adult patients develop osteoporosis, easy for you to say, and anemia. Untreated celiac disease can raise the risk of many other conditions, including an inflamed liver, hepatitis, and inflamed thyroiditis, infertility, lymphoma, diabetes, and rheumatoid arthritis. How do you diagnose celiac disease? It's one of those things that's both under and overdiagnosed, okay? Because you just took a look at some of the symptoms that are out there. It could either be one of those underlying causes, but if a doctor, if a prescribing medical professional doesn't do their due diligence, how much bread are you eating? How much gluten are you consuming? If you aren't taking those proper steps, if you aren't analyzing the diet that's out there, you're going to miss some things as well. So it's often blamed for a bunch of problems. I have a gluten intolerance. I just can't eat that. I just only eat things that are just, the box just has a no gluten sticker on it and then I just consume it. Meanwhile, it's just laden with sugar and a bunch of other genetically modified ingredients, which are just as terrible for you. So a lot of people use it as a scapegoat, but then also, it can't describe and can't figure out why they feel the way that they do, because they could either have it or they're just adopting the disease, molded by it, formed by it, and that's just informing their misappropriate decisions. All right. Tests that can measure a certain level of antibodies in the blood are good screening tools for diagnosing celiac disease. Current tests aren't 100% accurate. However, you probably won't be sure if you have celiac disease until you start avoiding gluten. If your symptoms go away quickly, the diagnosis is more certain. The gold standard of diagnosis, however, is a biopsy of the small intestine. That's probably very painful. So how is celiac disease treated? Stop eating gluten. There's only one sure cure for celiac disease. Give up gluten. And it's very, very easy. I condemned, those Johnny-come-latelys when it comes to, I just look at the boxes, and if it says no gluten, then I don't consume it, which is good. But many, many, many more companies are starting to outline and tell you when there's something that doesn't have gluten in it, okay? But if you're relying on those markers as well, chances are you're eating out of boxes or bags, which is just, you know what, hey, good practice to not be doing any of that, okay? With a little planning, people with celiac disease can enjoy varied diets. Several types of grains are perfectly safe, including rice, corn, flax, and sorghum. I wouldn't be consuming corn anyways, but, you know, oats are long considered a forbidden food, but recent studies suggest some people with celiac disease can safely eat them. Be cautious with oats, though. They can be contaminated with gluten during harvesting or milling. Avoid such foods with gluten if you plan your meals more creatively. You may want to talk to a registered dietitian. Dietitian can help you find gluten-free cookbooks. Yeah, it's pretty easy, actually. Feel free to indulge in potatoes. I'd also stray away from those. Fruits, vegetables, aged hard cheeses, meat, poultry, and eggs well cooked. Of course, any of these foods can be risky if they are combined with additives or other foods containing gluten. Eating a gluten-free diet may be a hassle. It's really not. It's really not if you just eat whole foods that, you know, just kind of look like the things that come out of the ground instead of the things that come out of the factory. You'll be pretty well set up, okay? But the rewards are tremendous. Your symptoms will quickly disappear, your intestines will heal, and your risk of developing other digestive diseases drop dramatically. And even if you don't have celiac disease, getting rid of gluten from your diet is a good way to go, because most of the time you find gluten in the diet, it's from a highly processed source, and you shouldn't be eating that stuff anyways. So, with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.